Hi, I'm Dr. Preeti Sharma. I'm Senior Consultant Pediatrician at Ankura, Gachibowli, Hyderabad. Today I will be talking about how to manage common childhood illnesses like cold, cough, some loose motions, ear pain at home. Now, this is not a substitute for visiting your pediatrician, but just basic simple things which can be done at home to keep the child comfortable. Starting with cold and cough, that is a universal pain problem for every parent, especially till 5 years of age. Children will go to school, catch a cold, cough, some fever and come back. So firstly, I would like to say the less medicines you use, the better it is. Below 1 year of age, please do not use any medicine on your own. Just saline nasal drops you can use for your child. Any other medicine, consult your pediatrician. You can use a nasal aspirator. You get like this balloon-like thing which you can suck out the mucus from the child's nose. That will make the baby comfortable. You can use a humidifier in the room. That also helps in the breathing to be easy. Otherwise, something which you can do is in the bathroom, just switch on the geyser at full heat, then switch on the shower at full heat for 10 minutes. Then the whole bathroom will be steamed. Just sit with your baby or child in the bathroom for 10 minutes. That helps in the nasal mucus to loosen up. Be very careful while giving steam directly to a child below 5 years. I have seen so many cases of burns by just little attention of the parent going here and there, and the child will put the hand. So that is much worse than a cold. So avoid giving steam inhalation, or if you're giving, do it very carefully. In children above 1 year, you can use some simple cold medicine which your pediatrician has told, but definitely no medicine for cough should be taken till 5 years without consulting a pediatrician. As I said, in younger children, the less medicines you give, the better it is. So you only have that psychological satisfaction. I am giving cold and cough medicine, child will improve. Nothing much happens, and they have their own set of side effects. In children above 1 year, during cold and cough, you can give some home remedies. For example, honey. Honey is scientifically proven to help in cough. So 2 teaspoons of honey in the night, maybe in the morning, that just soothes the throat of the child and helps the child feel better. Keep giving a lot of warm liquids. You can give warm water with tulsi, you can give milk with turmeric, you can give some soups. So warm liquids, small amounts if you give frequently, it will soothe the throat also, and it will also keep the child well hydrated. Gargling can be done only by children above 5 years. Below 5 years, they won't be able to do gargling, but just keep giving some amount of warm liquids. And as I said, steam very carefully from a distance, or the bathroom method which I suggested. Coming to the next common problem in children, fevers. Firstly, please do not panic if your child has a fever. Fever is just the body's way to fight something, like something has attacked your body, so the body mounts the fever. It is nothing bad. Yes, what is causing the fever we have to figure out, but do not panic in fever and over medicate the child. The first choice for fever for any age group is paracetamol. Please do not start giving your child mefenamic acid or ibuprofen immediately. Yes, paracetamol takes time for the fever to come down. Paracetamol may take half an hour to 1 hour to decrease the fever. Fever may come back a bit earlier. The fever may not go like to 97, 98. It may hover around 100. But that is the safest, and that is absolutely fine. In fact, below 100 temperature, you don't even have to give paracetamol. In children above 6 years, even you can wait till 101 fever before giving medicine. There is no such thing that it's 99, I should immediately give medicine. Children below 5 to 6 years, there is a mild risk of fever-related seizures, fits which we call, commonly known as febrile seizures. So in that case, yes, above 100 you can give paracetamol. Only if the fever is just not going down with paracetamol in younger kids, or it is coming back like just within 2-3 hours, then you can consider using mefenamic acid or ibuprofen after consultation with your pediatrician for the correct dose. But many times what I find parents doing is, okay, they gave paracetamol now, fever didn't go down, they started mefenamic acid, then they'll continue mefenamic acid only. And they sometimes give medicines like mefenamic acid and ibuprofen every 4 hours. These medicines can have significant side effects, gastritis, gastric ulcers. They can even affect the platelet count in dengue. So please use only in the given duration. If fever is coming back before that, you can manage with sponging. Now coming to sponging. Sponging has to be done with lukewarm water. Please don't use cold water. Lukewarm water, and you can just specially cover the forehead, underarms and groin, and rest of the body you can gently wipe. Sponging also does not decrease the core temperature. It just decreases the surface temperature. So don't worry too much if the child is not letting you do sponging or the child starts shivering after sponging. In that case, you can stop it. The third common problem we see in children is of loose motions. For loose motions, most important thing is to keep your child well hydrated. Use WHO certified ORS. Please do not use those Tetra Pak ones which are ORS-L. They are not proper ORS. They will cause more harm than benefit. Use actual WHO certified ORS. Whenever your child passes loose motions, keep giving little ORS. In between, you can keep giving coconut water, rice ganji. You can give your little lemonade. Preferred diet during loose motions will be curd, rice, banana, idli, khichdi, buttermilk, sago water, rice ganji. Milk should be decreased or stopped completely during loose motions. Please do not go to a chemist and tell my child has loose motions and then they will give this favorite medicine of theirs, OFM, which is an antibiotic. 90% plus of the loose motions are just viral loose motions or some transient disturbance in the child's digestion. Do not go for antibiotics without consulting your pediatrician. You can start a probiotic and you can even start zinc, but better to consult your pediatrician. In case child is having very frequent loose stools, not drinking enough ORS, there is blood in stools, then you need to urgently go. Otherwise, if in 1 or 2 days loose stools are not settling, please meet your pediatrician. Lastly, I will be talking about ear pain. Ear pain is very common in children, especially during colds. Now, it could be just because of the eustachian tube block, which connects the nose to your nasal cavity, or it could be an ear infection. For initial treatment, just give some paracetamol or ibuprofen for the pain relief. And next day, please book an appointment with your pediatrician and have the ear checked. Do not use eardrops blindly from the chemist. They can be dangerous. Just give some medicine for pain relief. If there is some pus coming out of the ears, which can commonly happen in children, just keep the ear dry, take a cotton and keep it inside. It will keep absorbing the pus. Give some painkiller and next day you can meet your pediatrician.